uh, from St. George's University's School of Medicine office. I'll be helping students with their recruitment process, with their admission process, so to say. I've quickly just pulled out a few slides from my main deck for you guys to have an overview of the university. And differently, so to say, we have it in the form of a few questions, because we understand that all of you students will have few questions in your mind that you need to be answered before deciding which medical school you want to pick up. So let's see if this proves to be helpful for you. What you currently see on the screen is a phenomenal campus. It's the true blue campus, like we call it, which is based in a small island country called Grenada. It's in the West Indies. It's the southernmost tip of the Caribbean islands. It's a $250 million, 66 building campus. And as you can see, it doesn't look any less than a 7-star resort or a property. And trust me, the picture doesn't do good to the actual campus. But here we are to give you a glimpse of it. Moving forward, the first question in anybody's mind who's looking at a US program would be, will I get a US residency or not? Before answering this question, Ranveer, if you would advise me, will your students be aware of what a residency is?
No, that I think they'll understand that. We have 2 students who are keen on USA, so I'm sure they're aware of it.
Perfect. So the first question they will have on their minds is, will I get a US residency or not? And a very happy and a big answer is yes, because SGU is the #1 provider into the first year US residencies, not for 1 or 2 years, but last 10 years combined. We placed about 961 US residencies in 2019 and 1124, that is 1,124 residencies in 2020. This also makes us the second largest source of licensed physicians to the current US workforce. Right? Also, to tell you that we are next to only one university in the States, which is the Indiana School of Medicine, as far as the number of students are concerned. If you do not consider any US university, then we are the #1 in the world, right? So the idea is to tell you that even a US university is not placing as many number of resident doctors in the US as St. George's, in spite of the fact that we are offshore, right? Also, this, what you see on your screen right now, is a very, very important figure, because this relates to you being an international student. So 91% of my eligible non-US students, which is international students, which is you, who apply for a US postgrad position, that means a residency position, obtain one at the time of graduation, which is the same year. So you see the success ratio of St. George's University is phenomenal, especially for international students. The same ratio, if you talk about the whole of my student body, it's about 95%. Right? The next question on your mind would be that, how will St. George's Clinical Network help me obtain a residency? Why St. George's, basically? So see, in the 5-year program that we take you in for, which is 1 year of pre-med, 2 years of basic clinical sciences, and the last 2 years of clinical rotation, the last 2 years plays a very, very important part, because they hold a lot of weightage when you apply for a residency program. So St. George's boasts of the widest network of hospitals that we are connected with. We have about 70+ hospitals spread across 3 countries in the world for our students to obtain the clinical training, right? Which is USA, UK, and Canada. So most of our core rotations are done in US and UK. We are tied up with about 55+ hospitals in the States and about 15+ hospitals in UK. We've got a variety of elective clinical options available in both these countries as well as Canada. The list of all these hospitals is available on our website, and if you require one, please feel free to reach out to me. Right? Now, let's think about what are the advantages of these hospitals. The first and the obvious advantage is because we have such a wide network, the probability of a student not getting into a clinical training is zero. It's literally zero. All my students get placed for a clinical network training. The second most important thing is that all these hospitals run residency programs. So the idea is to put you in the system before you have to enter the system, so that you get acclimatized to the system, to the environment, what you need to do, make your own network, how do you get recommendation letters and all of that, right? It just makes you very comfortable with the environment before you have to start working in that environment actually. The next most important qualification of these hospitals or this network is that a student need not complete the whole of 2 years or the 80 weeks of rotations at one hospital. Now, this is extremely unique. You can skip and hop between hospitals in the same city, in the same country, as well as among countries, which means if you want, you can do one year of your clinical rotations in the US and the other one in the UK. What it gives you is adds huge amount of value to your residency application because you've had exposure to different medical systems across the globe, right? These are among the top advantages of this network. The next question that would come to your mind would be that, does my education at St. George's prepare for me for US MLE, especially those students who are looking at US as an option. MLE is one of the most important things that they will look at. So again, a happy answer is a yes. And why a yes is based on statistics as usual. With St. George's, we don't want to talk anything except statistics. 96% of my students clear the USMLE step 1 in the first go every year. Again, we've maintained this for the last 11 years in a row, right? Now, if you see keenly on the screen, you will also say that, ma'am, other US or Canadian medical schools or USDO schools have a similar statistics. But what you need to understand is the advantage with St. George's, especially for you being an international student, would be that the number of international students at St. George's is about 24% of my total population, whereas the number of students in any other US medical school or a US or Canadian DO school would be less than 1%, right? So if you are not aware, once you complete your undergrad in the US and you have to appear the MCAT, there is a reservation of seats for you there, being an international student. So it's not just competitive, but there's a reservation of only 1% seats. So ideally, there are only 1% students in the entire population of medical schools in US and Canada. Whereas at St. George's is about 24%. So that's the advantage. The chances of you clearing the USMLE with us is much, much more, right? This is a very important slide in the entire presentation because this shows you the pathway of how do you become a doctor. Now, the last 4 orange circles that you see on the screen is year 1, year 2, year 3, and year 4, which is the US style MD because we follow the North American system of medical education. The first 2 years are basic medical or basic clinical sciences, and the last 2 years are clinical rotations or internships as we are aware of it. Now, this 4-year MD is identical to the US, right? It's not similar, it's identical. Why I say identical? Because we've got all sorts of accreditations that we'll talk about later in the presentation, right? So for you guys who are high school graduates, you will start the program right from the year 3 of the undergrad, which means you don't have to go through the entire 3 or a 4 year of undergrad, which you would have to go through if you go through the normal US route, the generic US route. You don't have to appear SAT. You don't have to do the full undergrad. You straight away get into the last year. You don't have to appear the MCAT after you do this last year. You straight away get into the MD, which is 4 years and which is identical to the USMD, which makes your program a 5-year program. 1 year of pre-med, followed by 4 years of MD, wherein the first 2 years would be basic clinical sciences or medical sciences, and the last 2 years would be the clinical internship or rotation. Now, the eligibility criteria to get into this 5-year MD would be an 80% plus in your 12th grade, 80% plus in all the sciences, a 7 band on IELTS individually and overall, and there'll be a non-academic interview. Now, other things like if you've shadowed any doctor, if you've done any community outreach, if you've done any assisted any research work, or if you've published any papers or anything of that sort would all be additional to the profile. What I've told you is the bare minimum that you need even to make an application, right? Now, if you see the flags below all these years, these are the places where you can do this program. So St. George's University has a collaboration with Northumbria University in Newcastle. So the year 3 of your preclinical or the first year of your pre-med, you can do in UK also. You can do the first 2 years in UK also and then go to Grenada only for 1 year. And then again, last 2 years of clinical rotations, you are anyways out. So there's a lot of permutation combination required, right? Available rather. Moving on, these are the 2 locations that we have. We've got another added location, which is the MS Ramaiah Medical College in Bengaluru, India. This year, 2020 September was our inaugural batch for the MD5 students. This option will be available to students only in 2021 September now. So if you're looking at a January intake, then you're looking at only Grenada. Newcastle and Ramaiah are available next September. Right? The last question probably that would cross your mind will be that where will my SGU medical degree allow me to practice? As we all understand, the world is becoming a very small place now, and it's important for us to do an education or to pursue an education or take up a line which actually helps us move freely across the globe, and we are not, kind of shackled in one country because we don't have a license to practice in another one, right? So SGU is an amazing opportunity for all of you guys because our graduates have practiced in all 50 US states, throughout Canada, and in more than 50 plus countries across the globe, including India. Now the question is, how are we able to do it? So the reason that we are able to do is twofold. One is that our degree is highly accredited and accepted all throughout. We've got the accreditation from Grenada Medical and Dental Council, which in turn is recognized by NCFMEA as a US comparable accreditor, which means that any students coming to St. George's have the full right to appear USMLE. If you don't have such an accreditation, you will not be allowed to appear USMLE, which most people don't know. And the same breath, we also have the CAM-HP, which is the Caribbean Medical Authority Accreditation. This organization in turn is approved by WFME, which is again a very, very important accreditator for medical schools and medical education. Simultaneously, we are also recognized by the US Department of Education, right? By the GMC in the UK, by the MCI in India, and about 43 more medical councils in different parts of the world, right? So what you see on the screen right now is the list of hospitals where eventually my graduates have worked in the past. And I don't really think there's any name which is not there, that there's any good name which is not there. There's John Hopkins, there's Massachusetts, there's Mayo, there's UCMLA, there's Houston, there's Mount Sinai, all of them. So our graduates have been placed in the best of the hospitals across the globe, right? So in all, the agenda of the university is to give you an outstanding experience and to also help you get your goal, which is to become a practicing physician, right? I'll open the house for questions now.
Yes, thank you, Priyanka. So we'll just take some questions which have come through. I'll ask, request Cynthia. She had a question on the application procedure, but I'd request her to also give a little brief about her and allow her to talk. Cynthia, if you wish to talk, you had mentioned you were keen for the UK. You've given NEET. You got 90% plus. Hello?
Cynthia, you'll have to unmute yourself, dear.
Hi, Cynthia. If you can unmute yourself, then we can hear you out. Okay, she had posted in the chat box, what is the application procedure? She was keen to practice in the UK. She's taken the NEET. She's got 90% plus in class 12. Cynthia Winfred Daniel.
So to answer your question, Cynthia, the application process is one of the most sought after and an easy process. Ranveer will be able to share a link with you, which will help you make the online application. You immediately get an automated confirmation stating that your application has been taken into the consideration. That email, that automated email, along with a set of documents like your LORs, that is letter of preferences, a financial statement document, your 10th grade mark sheet, your 12th grade mark sheet, your passport, and a picture. Don't fret over making a note right now. Ranveer will be able to help you with the list of these documents later. So these documents need to be sent to Ranveer, and then we can process it ahead of that. Generally, it will take roughly about a week for the preliminary assessment to happen, which will be, if successful, that will be followed by a non-academic interview. I will help you prepare for a non-academic interview myself, and post that you get the final outcome. The good thing about our application process is that we review the scholarship application simultaneously. So once you have an offer or an acceptance in hand, you will also have a scholarship in hand, which will be aiding your decision-making process whether to take up or not. I hope that answers you.
Right. We have...
And also for January 21 intake, this is the last leg of applications. So if you are looking at January 21, you must get in touch with us as soon as possible.
Right. She had mentioned UK, so as you mentioned, Jan is available for the Northumbria.
MD5, so January for MD5 at Northumbria isn't available. Northumbria will now be available only in September 21. So it's Grenada campus which is available. One thing which might be of use to you is that our Grenada campus might also be most likely be online because of the second wave in the European countries at the moment for COVID. What it looks like that it'll be an online campus. So it will not really make a lot of difference to your decision, because when you want to start next in September next year, you can start that from Northumbria if location is that important to you. So any location that you join right now would be online in January.
Right.
So instead of waiting till next year, it will make more sense for you to join right now.
So the traditional intake is in January at Northumbria for January.
So Northumbria intake traditional is September.
September, okay. So she could join the Grenada.
So what I'm advising,
right.
Yeah, what I'm advising is that she can join the Grenada campus in January, because even if other campuses were open, they would have been online. Grenada is online as well.
Right.
If it was for Northumbria, it would have been online as well. So she may take up the admission right now, and when in 21 she will do the second year, that time she can join in Northumbria campus.
Okay, she's just saying that she's traveling, not able to talk. So I just texted her if there's any further questions. Otherwise, we'll send her the information sheet and the application which we can fill up, and the list of documents which she needs to send up, which you have sent us, and the applications are done online through the portal, right? Which we can do.
Yeah.
Right.
You can connect her with me if she wants any more.
I think that may be also useful. Email her and put an email to you, and we can have a further discussion. Okay. And we have Sakshi Patel, who was keen for the US. She's done the NEET, looking for 2021 intake, approximately 80% in her grades. Sakshi, if you're free to talk, I'll request you to come online.
Hello, sir.
Yeah, hi Sakshi.
Hi, Sakshi.
Can
Thank you for joining in.
Thank
you
you, ma'am.
just give us a little brief of where you based, what have you done so far, and what your interest level is, and how old are you?
Okay, so I have given NEET, as you know, and I got 84.6% in my 12th standard. And I was actually looking for pharmacy in USA.
Hmm. Okay, so not the MD program.
No,
Okay, okay.
So,
So
Sakshi,
obviously,
when you can become a doctor, why do you want to become a pharmacist? Is my question to you.
that's a interesting thing that I really want to be a pharmacist then
okay,
to be a doctor.
okay.
Too sure if this makes a sense to you, but I've had a couple of student inquiries through the years who plan to do BScs first and then take up a postgrad into research or anything. But my little tad bit of suggestion to you would be that if research is on your mind, or if becoming a physician is on your mind, then taking up a clinical degree as your first degree would prove to be extremely helpful, if that makes sense to you.
Okay,
So instead of studying a non-clinical science degree, it will always be helpful to you to study a clinical degree or a clinical qualification as your first qualification, because that will eventually open up a lot of routes for you. So you can always be a pharmacist being a physician. But once you get into pharmacy, rolling back into the physician's cap sometimes is difficult.
okay,
So I'm not too sure what is the route that you are planning to take and where you want it to lead you. But yeah. If you want to talk about your profile in detail, just fix up a schedule with Ranveer and myself and we can discuss that.
okay, sure. Thank you, ma'am.
You're welcome. Take care.
So those were the main inquiries. Priyanka, as I mentioned, we have a few more who had registered and put in their inquiries. They haven't yet come online as yet. So I think it'll be useful if we can reconnect with them later.